Welcome everyone to WinWire's purpose-driven virtual fireside chat. We are thrilled to have you join us for our 27th episode. Whether this is your first time attending or a dedicated follower, welcome and thank you for being here. Our goal throughout this series is to feature thought leaders, entrepreneurs, innovators, and executives alike who have made purpose their mission. They do this by integrating innovative software solutions, leadership, and social good into the thread of their organizations. I'm Bianca Beatty, your moderator for today's Fireside Chat. Our topic for today's episode is Redefining Purposeful Healthcare Through Innovative Technology. Our chat will run until approximately 12:30, and at that time, we will open the floor for our live Q&A session. Without further ado, I'm happy to introduce you to our host, Ashu Goel, the CEO of WinWire, who will be interviewing our expert guest panelist, Dr. Justin Corin, the Chief Analytics Officer of Renown Health. Welcome, Ashu and Justin.
Thank you very much, Bianca. Appreciate it. And welcome, Dr. Justin Corin. Good to have you over here. We are delighted that you were able to make the time. I'm sure our audience is going to benefit significantly from that.
Happy to be here. Thank you very much.
Thank you. So hello, everyone. Thank you for being here. For some of you who are joining us for the first time, and many of you who keep coming back, as you heard Bianca say, this is our 27th episode. My name is Ashu Goel. I'm the CEO of WinWire. WinWire, for folks who don't know, is a global technology consulting firm that helps our client gain competitive advantage through innovative software solutions. And we do it by leveraging technology at the intersection of business value and through unleashing the power of Azure and OpenAI. So we are really super excited. And interestingly, during my tenure at WinWire, we've been around for 16 years. And prior to that, with Microsoft and A.T. Kearney, I've been very fortunate to be associated with many leaders who are gaining competitive advantage by leveraging technology at the same time driving purpose-driven innovation. What I mean by purpose-driven innovation, in my view, as I've shared before as well, it's an idea that purpose and profit in an organization can coexist. You don't have to be only either purpose or profit-driven. And in today's day and age, I believe purpose-driven organizations create a culture with a set of core values that center on changing the world for the better. Its leaders should articulate those values, and employees should embrace them. And with that, miracles can happen. And we have seen it happen across the organization. What I hope you will walk away from today is a renewed enthusiasm for purpose-driven innovation and the power of technology, along with a firm belief that even you can make a difference and apply this in your organization. Without further ado, again, welcome Dr. Justin Corin. A brief introduction of our speaker. He's an executive data scientist and applied medical sociologist with research interests in healthcare reporting systems, advanced analytic product development, medical decision-making, healthcare organizations, culturally competent medical care, physician-patient interaction, and healthcare quality. In 2023, Justin joined Renown Health as Chief Analytics Officer. Leading a diverse division of nearly 60 professionals, Justin is responsible for creating the strategy and vision for data engineering, data analytics, and data science across the enterprise. Prior to joining Renown Health, Justin worked at Noms Healthcare and University Hospitals Health Systems in Cleveland, Ohio. In both companies, Justin led the development of data science and analytics while serving as each company's first analytics leader and C-suite whisperer. Welcome, Justin. Thank you for being here. I briefly talked about what purpose-driven innovation leadership means to me, but I would love to hear from your perspective, what does it mean to you?
Sure, absolutely. And I loved when you used the words purpose and profit, because those are always key in business. But I would like to add a third word to that, value. So in the healthcare space, we really look at the term value. And when you think of purpose-driven innovation, even a strategic roadmap in order to accomplish, let's say in my field, an analytic or data science strategy, I go back to value. And how does a health system define value? And the way that we define value and the way we're currently talking about it in the peer-reviewed literature in the medical journals is not just looking at the triple aim or the quadruple aim. And of course, we want to be able to improve quality. We want to improve patient satisfaction. We absolutely want our providers and clinical staff to be happy at work and be satisfied with their job. And then at the same time, we want to bend the cost curve, right? We want to bring the cost curve down while accomplishing all of that. Ideally, if you accomplish all of that, that could be value. That's how a health system would look at value of our operations to a community and to the patients that we serve overall. But I'll add a couple other key points to value. Healthy at home is a big one, is we want to keep you out of the hospitals. We don't want to try to drive you into the hospital. We actually want to keep you out of the hospitals. We want to keep you at home. We want to keep you healthy at home. That is key value in the case where we can completely be able to manage all of your chronic conditions, manage the trajectory and the episodes of care within your typical journey through a health system, and be able to optimize that care profile for each person. And so I think we might talk a little bit about precision medicine a little later in the conversation, but this starts getting into that precision medicine conversation. So going back to purposeful driven, leadership or innovation, I think that is key. I think it is critical for our health system, but I think it is dependent on having a really good strategic vision as the leader that you can lead a team through, and then also keep an eye on professional development while you're doing that in order to maintain your team and really be able to encourage them and lead them through brand new product innovation and business challenges that you're trying to solve.
Yeah, very, very well said. And I'm glad you added the third element of value into it, because it is true. Sometimes we assume that to be the case, but being a healthcare provider, I think, it is top of mind. And as somebody who benefits from the services that you guys provide, I'm glad you guys are thinking along those lines and driving it. So thank you. That's very, very useful. One of the things, as we were looking at Renown Health, I know it's a national health leader servicing local communities and beyond, with a focus on innovative telehealth programs. And you talked about, healthy at home. Can you share a little on how telehealth is improving the health and well-being in remote rural areas specifically? How technology, things like AI, I know that's generative AI is the new thing right now. How AI in general is developing to reach and serve those in need more effectively.
Sure. So a lot to unpack here. We'll first talk a little bit about telehealth, and then we'll jump into the AI conversation. So telehealth has been around for quite some time, but the interesting thing about telehealth is it didn't take off until really the pandemic hit in 2020 and going into 2021. And then we were looking for ways to continually stay engaged with patients, knowing that we're restricting movement, right? We either have to stay home during that period of time in 2020 where we're all at home, or we're restricting whether you're going to work or you're working remote. And, we had almost this 2-year period of disruption in healthcare where, because of our public health emergency, because of COVID, we were losing that engagement touch. If we were seeing a patient 4 to 8 times in person in clinic a year in the primary care practices, we lost all those touch points because of that pandemic. So we had to lean on our telehealth offerings to be able to engage with our patients. And we went from about 10% utilization of telehealth services up to 67%. So a complete overnight change in the way we started delivering healthcare in response to just what was going on. What came out positively from the pandemic and all that is our telehealth offerings have strengthened, they've improved, they've become more engaged with the care team, and we're now seeing patients opt in for that type of engagement touch point with a clinical care team member much more frequently than before the pandemic. And I'm saying that specifically, one of the great ways we use telehealth is not always to have the patient meet with the physician, but have a patient meet with other members of the care team. So such as a pharmacist to ask about medication questions, a social worker where they could ask about nutrition assistance, or maybe they're asking about transportation assistance to be able to get to a clinic. So there's all these physician extenders that we try to surround primary care providers with in order to engage patients in a different way and be able to personalize their care experience within the health system. All those different touch points then start helping deliver our population health management strategy, which is then ties back to value and being able to keep patients healthy, keep them at home, but then also lower the total cost of care. And the healthier the patient is, the less that they'll spend per year in medical services. And overall, and this is not a surprise to probably many people viewing this type of a webinar recording and message, but we have a huge cost problem right now nationally.
Mhm.
We are spending billions of dollars as a country in healthcare, which is significantly more than any other established country worldwide. And so this is an area we really need to focus on and try to understand what can at least the provider side of the industry do to then lower the cost curve and be able to drive more value to our patients. Telehealth is one of those ways.
And Justin, just building on that, it was very impressive that it went from 10% utilization to 67%. How are you seeing the trends now post-pandemic?
So it's gone down. So it's not quite at the 67% anymore. And that makes sense because we wanted to bring patients, especially the sicker patients, back in person to the doctor because there are just some in-person touch points that are critical. And if you ever have to use techniques on the physician side, such as motivational interviewing or other things in order to create behavior change in your patient in order to change a health trajectory, that is much easier to do in person. So some of those things were not as successful in a full telehealth environment. Now it's come down to about 30 to 40% utilization of telehealth. We're back to around 60% in-person utilization. And then those numbers will probably stabilize around there now that telehealth has become much more popular today than it was, let's say, 4 years ago in that case. And then this is where the other technologies come in. Is now, to your point, with GAI and AI, and how can that enhance the telehealth experience? And that actually is the future for healthcare, is bringing those technologies into both the telehealth world, but then also the in-person world, and really talking about how are we using AI to improve healthcare.
Yeah, that's a fantastic segue into, one of the things that I was very curious about is, as you see all these emerging technologies, what trends are you seeing right now? Because the potential seems endless. It looks like it can impact from reading of the radiology, images to finding patterns that you probably wouldn't be able to look at that vast amount of data. What do you see as you look forward, maybe 2, 3, 4, 5 years? Would love to hear some thoughts on that.
Oh, it's going to be a different world. And I'm actually excited to help be one of the innovators that's going to help build this. So me personally, although I am a chief analytics officer today, I still do development work. I still actually pick a passion project, and it's usually an artificial intelligence development project, because that's the type of stuff that I'm currently doing now at this point in my career. And I'll grab one project, bring multiple staff around me, and shepherd that through. AI is going to be revolutionary in the future. But here's the interesting thing about AI. That's the buzzword today. Everyone wants to use the marketing word AI, GAI, but I don't think the average person actually understands what AI is in context to business or clinical care. So let me take 2 steps back and actually define that. AI, artificial intelligence today, the way I would view it, it's a collection of technologies. It's not just one technology. And what I mean by that is when we write an AI program and you design, let's say, an AI assistant in that case, what that program is actually doing is jumping to other programs that are written in order to execute a statistical model and analysis, look at a dashboard, look at a web page. Each of those different events that can occur is a different technology that can be written and created. And so an AI program is truly a collection of technologies together that will then try to be able to enhance the services or the industry in which it's deployed. So in our case in healthcare, we're going to have AI enhance the complete patient experience, but it will revolutionize the way we practice and administer healthcare. Let me provide some examples on both sides of what we can expect AI to do here in the future. So from an administration perspective and a leadership perspective, some of the for-profit companies can usually have much higher staff counts than, say, a nonprofit healthcare system. Nonprofit healthcare systems got much lower contribution margins. We don't have as much profit as a full for-profit company would have. And then that means we have to make some sacrifices on staff. So in a typical, let's say, for-profit company, you may have staff members that can be scribes. You may have staff members that can take notes in meetings. We usually don't have those staff members in healthcare, yet we have critical transcriptions of meetings that need to occur, especially in the healthcare space. We will have AI programs that will be able to transcribe meetings for us. There's a product that I actually just viewed from Microsoft called Microsoft Copilot. And this is something that can be deployed in a meeting room. This Copilot is part of like the Office 365 suite. It will transcribe meeting notes for you. Eventually in the future of this product, it'll be able to create web pages for you. It'll be able to create Power BI, Tableau dashboards, which is part of an external reporting system that a company may use. And each of those activities I just described could take a team of 5, 6, 7, 8 people, could take them weeks to a month to be able to create. And this AI engine will do it in hours, maybe even minutes. That is a profound transformation on the administration side of how we work with technology just to be able to do our day-to-day work. Other ways AI is going to work. I'll stay on the administrative side and then I'll switch over to the clinical side. Things, at least in the healthcare world, on the financial side, claim denials, claim denial letters. We will have GAI write our claim denial letters for us. So right now, an average health system could have a dozen people doing that. That's 12 FTEs you can redeploy to add more value to the company. So getting back to value. I never, ever see AI as a replacement for human resources. We will never, at least under my watch and within my divisions, my work, will never create an AI engine to either replace a person or replace a physician or decision-making process with that physician. We want the locus of control to stay with the clinical staff. So what we will do is if we automate a monotonous task or a task that's very standardized, we'll redeploy that person to where they can stay top of license and where we truly need them, being able to make the decision space that an AI engine is not going to make, right? Where you truly need people to be able to think through a complex problem and be able to provide a complex solution. There's not a lot of that happening right now in health systems. There's more people doing day-to-day, monotonous, standardized tasks than there are deployed actually having in-depth conversations about complex problems and how to solve that business challenge or clinical challenge. That's what will change. Whereas if you only have about 10 to 20% of your workforce currently doing that, and that's your talent, well, that might end up being 50% of the workforce here in a couple of years. And that's going to be a transformation that will be fascinating to see because business decisions will get made faster. Your administrative side on healthcare will start happening quicker, whereas we've seen faster paces outside the healthcare industry. Healthcare has never really caught up to some of that administrative pacing that we see elsewhere. So AI is going to really change the speed in which we do business in healthcare outside the whole clinical domain. And that would be interactions with payers, interactions with health information exchanges at the state level. And think about AI engines can help move data and manage data in all of those different scenarios. We will also have recommendation engines on the administration side that can also speed up decision-making and speed up some human resource type tasks. And again, these will be simpler decisions, not the more complex ones that some people might be thinking of. On the clinical side, let's first talk about physicians and what physicians and clinical staff can expect. So AI is currently being built into electronic health record systems. I actually just observed all the AI technology that's being built into the Epic EHR system, and it is revolutionary. Here at Renown Health, we'll actually be upgrading to the May 2023 version of Epic this coming February, in February 2024. That's the first version of Epic that has GAI built into it. And the way that that's going to work right off the bat is they're going to actually help draft responses in InBasket, which is the email communication platform of the Epic EHR. And let's say the average physician may take anywhere from 6 to 10 minutes to actually write a thoughtful email back to a patient based on either the clinical notes or the previous interaction, or maybe a laboratory information and results coming through. That GAI will write that email and provide a template to the provider. The provider will then go in and start changing individual words or phrases that are more specific on the medical decision line. So that 6 to 10 minute task now takes 2 minutes. If you can start saving 4 to 8 minutes per email per doc, you're now at the point where you're saving 2 to 3 hours a day per doctor. That 2 to 3 hours a day is either the saving of pajama time, where doctors previously were doing this at 8, 9 o'clock at night. That then goes away, improving provider satisfaction. Or that was happening during the day. You're now saving 2 to 3 hours, and then you have a decision to make. Do you free up that time and have better work-life balance for your physician workforce, or is there an opportunity to maybe even add more patients in with that time? Depends on specialty. Let's say primary care. Well, then maybe you can add a couple more patients if you're saving 2 to 3 hours in your day. Now that translates to a revenue and a value play there. So not only are you increasing physician satisfaction, you're adding more patients that you can actually see in your system, therefore generating more revenue and increasing your engagement. So GAI is going to have a profound impact on just the number of hours in a day either a provider has to do administrative burdensome work or can see patients. And that's only one example of GAI being built into the EHR. There are other types of examples, such as being able to actually ask questions in your EHR, and the EHR will provide you the answer. So a doctor, let's say they want to ask a question: how many type 2 diabetics do I have in my patient panel? I've got 1,600 total in my patient panel. I know that, but I don't know how many are currently diagnosed as type 2 diabetics. You either can ask verbally that question into the EHR, it will listen to you, or you can type that question and then the response comes back. The response that comes back could just be a one-line response, but AI is becoming so sophisticated in EHRs that it can actually produce a full report and dashboard, and that be the response back to you. And something that you can then interact with the data that's all happening, and all that was produced by an AI engine, not a person. That average activity by an analyst or a person on average can take anywhere from days to a month, depending on the complexity of that report and the complexity of the data that's coming to that report. So again, we're talking about something that could take days or weeks that's now being distilled into minutes, all because of the implementation of AI. Other areas that we're going to start seeing is things in charts and charting, where charting notes and charting and documentation tasks are sped up. And that's the promise of GAI, specifically in large language models. You're also going to see the rise of AI assistants. And the AI assistants will be much more complex AI programs than a GAI program that's looking at large language models and is primarily returning some kind of text-based description back to you. In the AI assistant space, it will almost be exactly if the audience is familiar with Marvel movies and remembers Iron Man, and if you remember when Robert Downey Jr. and the Iron Man character created Jarvis, that is our reality in healthcare. We are working on creating the Jarvis of healthcare for doctors. The idea behind this is the assistant can actually pull information up in the EHR or outside the EHR upon verbal command from the doctor. So for example, how many type 2 diabetes or how many type 2 diabetic patients do I have? And it says, okay, well, Dr. So-and-so, you've got 600. Show me the list of 600. Now all 600 show up in an Excel spreadsheet. Of this 600, how many of them have an A1C lab result that I have ordered to make sure that they're in control and following our national guidelines around type 2 diabetic care? Oh, so then a brand new report pops up and now shows you the breakdown of how many has an A1C. When was the last time you ordered it for each one? When did they pick up their prescription medication that you last prescribed them? I mean, and that's a game changer. The way that typically worked in a modern healthcare system is a physician wants to know that information, they would have to put in a request. Request goes into some kind of platform or system that either then triages to IT or an analytics department, or sometimes both, depending on where certain operations are occurring in the company. And then after 3, 4, or 5 people touch that project, maybe the doctor will get the data back. Probably not in hours. We're probably talking days. In less mature health systems that are less mature on the analytic curve, that could take weeks. So now you're talking about weeks from the point of asking a question to producing the knowledge to be able to operate off the question asked. This in the EHR with AI will then happen in seconds and minutes. So again, this is a revolutionary and profound change to the way health systems and doctors are going to practice medicine and bring these different technologies into their workflow. The last thing that I'll mention on that is now clinical decision-making. AI will be in the space where it will help make clinical decisions. So for example, we're seeing some of this in oncology oriented image analysis, where the machine is trying to pick up potential cancer or irregularities within cellular structure if you're looking at a pathology image within a slide. And so the machine is phenomenal at doing that. And the AI is so good at doing it, it can even pick up potential cells that are malignant that your eyes may not be able to see. So the machine's seeing it where a person may not have been able to see it discriminately the exact same way, and then provide that recommendation back to the doctor. And then that from there, the doctor has to make a clinical decision on follow-up of either diagnostic criteria or do we go into a treatment and care plan. And so the sky's the limit for AI, whether it's recommendation engines or rule-based algorithms. This is the future.
Yeah, no, this is fascinating, Justin. And as you said, I mean, I can see how passionate and excited you are about it. And I'm seeing tremendous opportunities. One of the things that I would like to see is in a patient care setting. Majority of the time, I see, unfortunately, doctors are just typing away when you're talking to them. Simple stuff, instead of staying connected to you, really paying attention to what you're saying, they're trying to do, multitasking, and that experience, even though they're doing the right thing by capturing information, I think if that just simple experience can be fundamentally changed as well, where they don't need to worry about it, where it can be automatically recorded, transcribed, summarized, and accurately. I think that's what they're worried about is that while they're paying attention to what the patient is saying and how the patient is saying it, as you were saying, behavioral change, helping drive some of those things in patients would go a long way. So I completely understand. And I can see why you're super excited. I'm super excited about it as well. Let me ask a slightly different question tied to it is, as you see this tremendous amount of change that's going to go through the organization, what do you see as sort of the leadership qualities that are going to be needed in an organization to really guide the organization through this massive change that's going to go through, including what you earlier talked about is calming the fears of people, that this is to augment, not to replace? Would love to hear your thoughts.
Leadership is going to be critical to deliver that message. And so we're seeing definitely a change in even C-suite leadership within health systems today. Financial industry was there probably a decade ago. Health systems are just catching up today. Usually health systems are among the last to catch up to things that other industries already figured out and had implemented before. But now in C-suite, we always had CIOs. You always had a C-level leader that understood, let's say, IT technology in general, how that was going to run a business. But with the invention of electronic health record systems, it's completely changed the game as far as how we use technology to make decisions. And there's now so much science and nuance within analytics, data science, data engineering, how you're going to store your data. Do you create an enterprise data warehouse? Does all those operations in-house? From there, are you actually creating an analytic roadmap where you're building analytic products in-house to deploy in your company? Or of course, you can do the reverse. You can go buy products and bring products in. So those are really the two big decisions you're making as an executive. But the executive structure has changed, where there's now people like me that's fulfilling a chief analytics officer role or a chief data officer role or CDAO if we're combining the two together. And that's a different voice now in a boardroom, where you're now bringing data to the conversation and you're eliminating the phenomenon of having emotional decision-making in the boardroom, and you're replacing it with rational decision-making off really good, clean, cultivated data. That is a change. We are now able to take a look at scenarios in the healthcare space where you're trying to drive a process and only improve something by 1, 2, 3, or 4%. So we're not looking for the big low-hanging fruit where you can see a big change in outcome, but how do you make incremental change? In order to make the incremental change in today's modern world requires statistics and requires us to understand what do you need to change, across a scaled and large corporate operation to actually achieve a 2% raise in, let's say, revenue or quality or satisfaction, whatever KPI or metric you're trying to work on. And that's requiring advanced statistical analysis and then interpretation to the business world. And that was not traditionally what a CIO was trained on. That was not traditionally what an IT department was trained on. And if you look at the clinical side and you look at allopathic medical curriculums, Doctors aren't trained in that either. So there was no professional, historically that could provide that type of counsel and advice and really be able to describe what will this piece of technology do in the context of clinical operations or administrative operations within the company. That voice is here today. So that's another big change. The way we now discuss things is you might have 1, 2, or 3 executives in a boardroom bring something up, and then everyone stares at me and waits for the data to come up on the screen. And then we start talking once the data is up and everyone's looking at the same view. So leadership has changed a lot because the narrative has changed. And then going down the pipeline, not just C-level leadership, but now I think it's critical that if we want to retain talent at a staff level in this space, there are more open positions for data scientists and advanced analysts and biostatisticians and even data engineers in the country than we have people that can fill those positions, making it extremely competitive. Before I came to Renown, the data science analytics division had a 25% churn rate. And that's high. So that means you're not retaining your talent. You're not retaining historical intelligence within the company and be able to really build a bench strength of scientists. And there's a lot of reasons for that. And so now when it comes to leadership, the way that you would operate that department has to change. You can't treat it like a finance department. You can't treat it like an HR department. You actually have to treat it like a science department. That's leadership. And that's actually changing. Go back to the very beginning when you say purpose-driven leadership. This is purpose-driven leadership. This is a recognition that you have to treat this organization and this part of your company very different. They need to go to conferences. They need professional development. The technology and the techniques are changing so fast that you must have that continuous education on your talent and within your skilled workforce, or they will fall behind. And so oftentimes in a health system, you can't send everyone to conferences. You can't fund that type of activity across all the departments. So by centralizing them all into a analytics department or a scientific department, you now can surge your resources there and get it to the right proportion of your workforce that's going to truly do that type of work and needs to stay on top of the evolving trends of both technology and AI.
Yeah, no, I very well said, very well put. I think across the organization and the way you look at it is changing. And I think, it's also a change management exercise of just managing people, guiding them through this big change and helping with that. I completely agree. I have a whole bunch of more things, but I know we are coming towards the end, so I'll ask just a couple of more questions. I know we started the conversation and you talked about precision medicine. What initiatives are you most excited about within your organization at this point?
Sure. Being able to look at a person holistically, so all the different facets of a person, understand that, and then be able to tailor a medical program to that person. What most people I don't think realize, provider organizations have among the most data points on an individual in the country. Not only do we have your entire medical record, we usually have your entire financial history because you're paying for healthcare. We have all the information that's going to insurance and payers. But then we also purchase information from national aggregators where we have your social determinants of health or social influencers of health information. That can be your mortgage history, your criminal history, your transportation history, how many cars you have, how many addresses you have. When was the last time you bought a boat? Do you do boating? And so we know your social activities, your hobbies, your financial history, your stressors. We can combine all that data with your medical information. We can combine all of that and be able to see a 360-degree view of what's truly driving your health, both physically and behaviorally, and then operate on that. And that is the most in-depth insight any industry is going to have on an individual. So the idea of precision medicine, we truly can tailor it to you because we have the data points to do so.
That is so true. Actually, I never thought about that until you said. I don't think there is any other industry that collects all the data points or can have access to it, because the most sensitive data sits with the providers, with the healthcare systems. And so if you can get the rest of the data, your data is not going to go anywhere to somebody else. a finance company is not going to get your data to process a lease agreement with someone. So that's very interesting what you said. And I think that's a very, very critical area. And I think it becomes even more important for the health systems to invest in data science and data engineering and data analytics, and to help us get to that precision medicine. Very, very well said. Just a couple of quick things to wrap it up. As I said, there are a lot of sort of young people and middle level leaders who listen to it as well. How do you foster and encourage sort of creative thinking among team members? I'm sure they would love to hear your thoughts on that.
Sure. You have to empower your staff. I can't stress that enough as a leader, and empower them in different areas of the company, because that's what's going to drive their passion and innovation. And here's what I mean by that. So if you have a data and analytics governance program that you have built in a health system, and they're critical for health systems, almost all health systems should have a data and analytics governance program. That type of program is talking everything from how you're sharing data internally and externally to the organization, to how you're creating reports, to what your brand image looks like, to the standardized definition of how you're going to measure a readmission rate or measure mortality or some major key performance index or indicator that we want in healthcare. And then overall in that space, it's going to be a really interesting journey on how we fully get there today and bring all the different components together that were previously disparate. Now we're centralizing it. So when I say disparate, both administratively, data, analytics, people, bringing it together. That data and analytic governance program allows your staff to be able to communicate across your company with other subject matter experts across other administrative divisions. They can be true stewards, both analytic and data stewards, and feel like they're participating in the business of the company. That empowers them, because they may have an idea of how do you improve a business challenge that might come up in a committee, of which case that might become a project that they're actually deploying and fixing something. By not having them involved and be able to interact with an interdisciplinary committee across your company, they may never have an opportunity to even make that suggestion. And so to truly empower the staff, you need to get them out there. You need them interacting with your doctors. You need them interacting with your nurses. The other thing that I encourage my staff to do in order to foster creativity and innovation is have them go spend a day in the clinic. Have them go shadow a surgeon and go to surgery for a day. Actually watch the workflow of the nurses and the doctors together, and then come back to the boardroom or the meeting room and discuss in context, how can we improve that process? Is it as efficient as it can be? Can we speed it up? Can we improve it? Can we get them more data to be able to make a more efficient decision? And so those conversations are extremely fun to have when your staff come back from the field and they're done meeting with the patients. And so that's how I encourage it. So I encourage it by participating in enterprise programs. I have them shadow clinicians and go into the medical side so that they can stay connected to that part of the business and their innovation. And then the third thing is getting them involved with conferences and other scientists nationally. That way they can feel connected, not just within the organization, but external to the organization with like-minded colleagues.
Very well said. And it ties back to what you were saying earlier around continuous learning. I think in that's another area, by sending them to conferences and others. Justin, as I said, I can keep going on and on. I think I'm learning a lot, and it's been very, very interesting and inspiring conversation, I must say. But I know there are a bunch of people waiting to ask you questions. So I'm going to have Bianca come back so that it's not just me talking to you, but the folks get a chance to ask some of the questions.
Absolutely. Yeah, that was wonderful. Very informative.
Yeah.
Thank you, Ashu and Justin. We're now going to open up the floor for our live Q&A session where you can ask our panelists any questions you may have. If you haven't already, please type your questions into the Q&A chat box found at the bottom toolbar. Great. So our first question comes in from Ben. He asks, have you had a mentor in your life who has impacted you as a leader?
I did. And it happened in college. So I think similar to a lot of people, in my field. I originally wanted to be a doctor. I loved medicine, knew I wanted to go in there, thought I was going to medical school, but I didn't realize I had a talent for research and data science and actually seeing patterns in data that weren't common to be observed or seen by the average person. And I kept being told by my professors, you have a talent in this area, you should really, consider this. And it was really that mentor that then steered me away from med school into grad school and really taught me that you can be an executive, you can be a leader in this space. And I, to this day, there was a statement that my mentor told me that still sticks in my head and keeps me grounded to work I do. And she said this to me. She said, Justin, you could go to med school and be amongst the most competent doctors that this professor has ever had the opportunity to teach. And you will save a patient one by one each day. And maybe over your career, maybe you'll save 10, 20,000 patients. Or you could become an innovator and a leader and create analytic products that could potentially save millions of patients. And if you are an executive and you can work your way up to be a medical school professor, which is actually what I ended up also doing. I'm an adjunct professor in UNR here in Reno. I was previously at Case Western Reserve University. They said, for each medical student you teach, and you can teach your techniques, how many more patients are they saving? And therefore, I realized that going on the other side of medicine and teaching and innovating, I may be able to impact many more patients than being an individual contributing doctor. And that was the direction I went. And it was profound for me because that was really what changed my whole perspective and philosophy and how I was going to approach my work in healthcare.
Very cool.
Wow, that's incredible. Thank you. All right, our next question comes in from Josh. He asks, what are some of the key performance indicators, KPIs, you track to measure the success of your analytics initiatives in improving patient care and hospital operations?
So honestly, there's thousands of them. And every single administrative area and clinical service line has their own KPIs. We try to come up with 2 to 3 per service line and per administrative area. And that even includes mine. So in the data science analytics space, the way we look at KPIs would likely be engagement with our workforce in a different way. So how many total reports and assets do you have built for the company? What does that engagement look like on those reports? How often are they being used? So that's some of the admin KPIs on the data science analytics side. On the clinical side, you've got all your clinical KPIs. Those are usually tied to value-based care programs, population health management, your payer contracts in there. That could be everything from looking at A1C control and making sure your diabetics are well treated and well managed. But that can also go into readmission rates. That can look at surgical complications. The acute side of a hospital is going to have much different KPIs, and they'll be split between business KPIs and clinical KPIs versus an ambulatory practice. And those KPIs will be very different. On the administrative side, we always look at things like total cost of care. You're going to look at return on investment, return on engagement. We're going to look at PMPMs, which are per member per month. It's a very payer way of looking at the consumption of cost of care and services. And so KPIs exist everywhere. And I'll be honest, they change every year. So some institutions will customize their KPIs. The payers will have a customized series of KPIs per insurance product. And so at the end of the day, you could have thousands. And then it's really about orchestrating them and getting them to the right people to operate off of in a meaningful way.
Really interesting. Okay, our next question is from Karimi. Any book recommendations, recent or past, that has impacted you?
From a book?
Yes.
Great question. What I've read a couple books on like AI ethics that have really got me going lately, because I've been thinking a lot about this, and I'll give it a use case that they discussed in the book. And I'm still trying to look for books that discuss this. So I'm happy to receive any recommendations from anyone that may know. However, 2 things I'm looking at in the AI ethics space. So number one, I mentioned earlier in the recording how much data the provider side has. So that includes social media data. So what happens if I can see within the social media data that you're now looking at knee replacements and you're doing Google searches for knee replacements? Should I reach out to that patient to proactively discuss orthopedic surgery? And that's where the ethics come in. To what extent should we start using your behaviors in your social media space or in your other area to then influence how the healthcare system is going to engage with you? That's an ethical question. And that's not one that's black and white that we easily have answered yet. But there's a series of books that are walking through these ethical scenarios involving AI in healthcare that I'm finding very fascinating and very relevant, because we're having literally these debates in the boardroom and we don't have a black and white answer yet. So that's the type of books that I'm currently reading now and are fascinating to me.
I have a recommendation for you. I just saw Eric Topol speak at a TED conference, and he wrote Deep Medicine, which is a great, fascinating book if you haven't read it yet.
I have not. That's on my list to read.
Okay, great. All right. And I think we have one last question that came in, and it's from Jennifer. How do you collaborate with other departments like IT and clinical teams to ensure the successful integration of analytics into healthcare processes?
Sure. IT is critical. IT becomes a sister department where you cannot realize an effective analytic strategy without a good collaboration with your IT department. If IT is running your network and your information infrastructure systems, well, you need all that to run analytics. And IT is critically important. The way I always discuss IT and enterprise data analytics in context, because they're two totally separate operating divisions, is it's a bucket and water analogy. IT is the bucket. They're in charge of the container that contains all the data. They discuss how big that container needs to be, what the container is made out of. And that's really the IT responsibility in that. But then we're responsible for the water, all the information you put into that bucket, what you do with that water, who can touch that water, how that water is distributed across your company, then all falls into the analytics and the data science operational domain. You can't have one without the other. You need a bucket and a water to be able to move that water somewhere. Other administrative departments, if you have a centralized analytics function, you're usually doing all the data analytics for every single administrative function and service line. So that means they have to have reports. There's regulations where they might need to send data to payers or send data to CMS or some other third party. And so we're literally automating all of those options so that somebody in that division doesn't have to manually do those tasks. So that's one way that we work very closely. I also work with, let's say, in the service line. So each doctor works with my team in development. So we're customizing analytic products by the service line with the doctors in the trenches with us developing them. And that's, I think, the nuance of a provider organization. You've got many tech companies that want to sell you an AI tool. Very few of those tools were actually developed alongside doctors and nurses, like literally in their workflow, in the hospital, in the medical practice, and develop them. And that's what we're doing here at Renown Health. That's where I did previously at University Hospitals Health System and Gnomes Healthcare. And I see a lot of other health systems starting to do exactly that. The Stanfords, the Johns Hopkins, the Mayo Clinics of our country all have strategies right now that are doing exactly that.
Oh, that's fascinating. Okay, so on to our lightning round of questions. The first question is, name your item on a bucket list or on your bucket list.
I want to do an African safari.
Me too. Actually, Ashu just got back from an African.
I just got back, so I can certainly tell you more about it.
Yeah. Oh, me too. Coffee or tea?
Coffee.
Okay. If you could have any superpower, what would it be?
The ability to control magnetism like Magneto and be able to bend metals around.
Very cool. Dogs or cats?
Dogs.
Mountain or sea?
Oh, mountain.
Okay. If you could have dinner with any historical figure, who would it be?
Good question.
Living or dead?
Living or dead. Okay. Probably Barack Obama.
Okay. Nice. Very cool. All right. Well, that wraps up our Q&A. Thank you very much for your questions. On behalf of WinWire, I'd like to extend my gratitude to both Justin and Ashu for a wonderful session. Today's event will be available for on-demand access by going to winwire.com. If you'd like to stay on top of the latest news, technology solutions, and events, please follow us on our LinkedIn, Twitter, and Facebook pages for up-to-date information. Thanks again, and see you next time.
Thank you.